This is Med School Radio. Welcome back to Med School Radio. Let's continue on with the respiratory system. Age-related changes to the respiratory system include decreased chest wall compliance and decreased alveolar elastic recoil with resulting alveolar enlargement and air trapping. These changes limit the potential increase in tidal volume and also increase the alveolar arterial O2 gradient, i.e., decrease the efficiency of alveolar capillary gas exchange, reducing the ability to compensate for hypoxemia. An excess of Th2 cell activity relative to Th1 cell activity may underlie the pathogenesis of asthma. In the asthma sensitization phase, inhaled antigens stimulate Th2 cells to secrete interleukin 4 and interleukin 13, which together promote B lymphocyte class switching for IgE synthesis, leading to mast cell priming. Th2 cells also secrete interleukin 5, which activates eosinophils. Emphysema most commonly results from chronic smoking, but can also occur in genetically predisposed individuals with alpha-1 antitrypsin deficiency. Patients with emphysema have a decreased forced expiratory volume in 1 second/forced vital capacity ratio, increased total lung capacity, and decreased diffusing capacity. Type 1 hypersensitivity reactions are an allergic response triggered by the binding of previously recognized antigen to IgE antibodies on mast cells. In the early phase of the response, histamine, already stored in preformed granules in mast cells, is the first chemical mediator released. Once released, histamine stimulates smooth muscle contraction, which is bronchoconstriction, and increases vascular permeability, edema, and increases mucus secretion. Pancreatitis is a major risk factor for acute respiratory distress syndrome, and it results in the release of large amounts of inflammatory cytokines and pancreatic enzymes, which leads to activation of neutrophils in the alveolar tissues. During the initial phase, interstitial and intraalveolar edema, inflammation, and fibrin deposition cause the alveoli to become lined with waxy hyaline membranes. Ventilation perfusion or VQ scans use radiotracers to compare the ventilation and blood perfusion of each area of the lung. VQ mismatch with perfusion defects are often indicative of pulmonary embolism, which are most commonly caused by deep vein thrombosis in the lower extremities that embolizes to the pulmonary vasculature. Pulmonary arterial hypertension results from endothelial dysfunction that leads to an increase in vasoconstrictive pro-proliferative mediators, for example, endothelin, thromboxane A2, and a decrease in vasodilative anti-proliferative mediators, for example, nitric oxide and prostacyclin. The relative imbalance in these mediators leads to vasoconstriction and intimal wall thickening, with a consequent increase in pulmonary vascular resistance. The primary virulence factor of Streptococcus pneumoniae is polysaccharide capsule that inhibits opsonization and phagocytosis. The polysaccharide capsule of the most virulent strains is targeted by the pneumococcal vaccine, which confers immunity against those subtypes. Corticosteroids, for example, fluticasone and budesonide, have multiple beneficial effects in the treatment of asthma. In addition to their anti-inflammatory effect, corticosteroids upregulate beta-2 receptors on bronchial smooth muscle to increase cellular responsiveness to adrenergic stimuli and potentiate the bronchodilatory response to inhaled beta-2 agonists, for example, albuterol. Dimorphic fungi grow as molds 25 to 30 degrees C and as yeast at body temperature 35 to 37 degrees C. Medically important dimorphic fungi include Sporothrix, Coccidioides, Histoplasma, Blastomyces, and Paracoccidioides species. Infection with Mycoplasma pneumoniae can result in the formation of cold agglutinins, which are IgM antibodies primarily, that bind red blood cells and cause clumping or agglutinations at low body temperatures. Other illnesses resulting in cold agglutinin formation include infectious mononucleosis and certain hematologic malignancies. Polyribosyl ribitol phosphate is a capsule component and major virulence factor for Haemophilus influenzae type B or HIB. HIB is the most common cause of epiglottitis, which presents with fever, stridor, and dyspnea. Arterial partial pressure of carbon dioxide, or PaCO2, is the major stimulator of respiration in healthy individuals. Even a slight increase in PaCO2 stimulates central chemoreceptors and triggers increased ventilation. In patients with chronic obstructive pulmonary disease, the response to PaCO2 is blunted, and hypoxemia can contribute to respiratory drive. Peripheral chemoreceptors are primarily responsible for sensing arterial partial pressure of oxygen, PaO2, and can be suppressed with oxygen administration. The PO2 in the left atrium and ventricle is lower than that in the pulmonary capillaries due to mixing of oxygenated blood from the pulmonary veins with deoxygenated blood from the bronchial circulation and Thebesian veins. Interstitial lung disease is associated with decreased lung volumes and increased lung elastic recoil caused by fibrotic interstitial disease, interstitial tissue. The increased elastic recoil results in increased radial traction, outward pulling on the airways, leading to increased expiratory flow rates when corrected for the low lung volume. Etomidate, a GABA agonist, is often used for anesthesia induction to provide sedation and amnesia. It is hemodynamically neutral, but it can result in transient adrenocortical suppression because it inhibits cortisol synthesis. Gas exchange between the alveoli and pulmonary capillary blood depends on both perfusion and diffusion. The exchange of O2 and CO2 in a normal individual at rest is perfusion limited, so alveolar and capillary partial pressures are equal. Situations in which O2 exchange becomes diffusion limited, for example, emphysema or pulmonary fibrosis, can cause a large gradient between the alveolar and capillary. PO2, PCO2 is less affected due to greater diffusing capacity of CO2. Patients with cystic fibrosis have thick, viscous mucus that accumulates in the airways and promotes colonization of bacteria, particularly Pseudomonas. This gram-positive rod can produce biofilms, which act as a protective matrix that allows bacterial macrocolonies to develop, causing persistent infection.